Magandang tanghali po. Magandang tanghali po sa ating mga kababayan at sa Malacanang Press Corps. Una po sa lahat, papasalamat po kami sa kooperasyon at pakikipagtulungan ng lahat mula sa mga opisyal ng simbahan hanggang sa mga deboto sa taimtim na paggunita sa pista ng Itim na Nazareno sa gitna ng tumataas na bilang ng COVID-19 sa bansa. Ito po ang mensahe dito. May saysay at pakikiisa sa pagsunod sa minimum public health standards. Ganito po tayo magtatagumpay laban sa coronavirus. Lalo na ngayon na ang ating bansa, ayon sa Department of Health, ay nasa critical risk classification. Umpisa natin ang briefing. Sa regular talk to the people kagabi, ito po ang ilan sa mga salient points. Binigyang diin ni Pangulong Rodrigo Roa Duterte na patuloy ang kanyang pakikipagpulong sa mga opisyal at pakikipag-usap sa publiko sa gitna ng tumataas na kaso ng COVID-19 sa bansa. Kasama ito sa trabaho, wika ng Pangulo. Your government is here for you and we assure the public that government services will remain unimpeded even in the face of the rising number of COVID cases. Ayon sa Pangulo, in the process, tamaan man kami ng COVID-19, simba ko lang, kasama ito sa aming trabaho. Samantala, in-report ng Department of Health na 60% ng samples na kanilang na-sequence ay positibo sa Omicron variant. Kaugnay nito, papaigtingin natin ang pagpapatupad ng Prevent, Detect, Isolate, Treat, Reintegrate strategies. Habang patuloy nating pinapaalala sa publiko ang halaga ng mask, hugas, iwas, plus ventilation, plus bakuna. Aning sunod naman sa naunang utos ng Pangulo. Ayon sa Department of the Interior and Local Government, nasa 748 PNP personnel ang na-deploy sa 270 DOH, BOQ, DOT hotels that currently houses 18,562 returning overseas Filipinos under quarantine. In-report din kagabi sa Talk to the People ang target ng administration na mabakunahan ang 70 milyon Pilipino bago matapos ang June 2022. Sa bilang na ito, nasa 28 million to 30 million ang kailangang mabakunahan na hindi pa bakunado. Kasama na rito ang 3 milyong unvaccinated seniors. Binanggit din kagabi sa Talk to the People na inaprubahan na ng Food and Drug Administration or FDA ang Compassionate Special Permit ng Bexovid, ang first generic version ng Pfizer Paxlovid. Ano po ang implikasyon nito? Magiging mas mura ang gamutan at ma-access ang gamot na ito sa DOH at government hospitals. Mababawasan ng Bexovid ang risk ng hospitalization or death by 89% kung may bibigay sa pasyente sa loob ng unang 3 araw ng sintomas. Mamaya ay makakasama natin si Health Undersecretary Leopoldo Bong Vega para pag-usapan ito. Inulat din ng FDA na may 2 manufacturer ng self-administered COVID-19 test kits ang nag-apply ng special certification. Ito ay kasalukuyang nilang ine-evaluate. Samantala, muling umapela ang Pangulo sa mga Pilipino na magpabakuna kontra COVID-19. Kaugnay nito, ayon sa National COVID-19 Vaccination Dashboard, as of January 10, 2022, nasa mahigit 114 million na ang total doses administered. Nasa mahigit 62 million ng ating mga kababayan ang nakatanggap na ng first dose. habang halos 53 million ang fully vaccinated. Nasa mahigit 3.5 million naman ang nakatanggap ng booster dose as of January 10, 2022. Hindi kami magsasawa sa pagpapaalala ang mga bakuna natin laban sa COVID-19 ay may emergency use authorization mula sa Food and Drug Administration. Lahat ng ito ay ligtas at epektibo. Lahat, anuman ang brand, ay nagbibigay ng proteksyon laban sa severe at critical cases ng coronavirus. I-share ko lang po sa inyo na ang aking ina ay bakunado ng 2 doses ng AstraZeneca at nag-booster na rin po siya ng AstraZeneca. Ito ang proteksyong baon-baon niya mula pa sa umpisa. Wala pong bayad ang bakuna. They are all free. Pwede na po ang walk-in para sa mga nabakunahan. Pwede na kayong magpa-booster shot gamit ang Sinovac, AstraZeneca, Pfizer, Moderna at Sputnik pagkatapos ng 3 buwan at 2 buwan naman kung ang gamit ay Janssen. Kanina nabanggit ko na meron po tayong 3 milyon na senior citizens na hindi pa po bakunado. Pakiusap po namin sa mga lolo at lola at sa kanilang mga mahal sa buhay. For yourselves and for your families, please get vaccinated. Our seniors are vulnerable to COVID-19. According to the World Health Organization, and I quote, senior citizens are at highest risk of deaths due to COVID-19. End of quote. And in the country, 7 out of 10 deaths are in patients 60 years old and above. Mas kailangan po nila ang dagdag proteksyon na binibigay ng bakuna. Kahit ano pa ang brand nito. Inulit namin, hindi na po problema ang supply ng bakuna. In fact, nasa 2,703,870 doses of Pfizer vaccine na donasyon ng Estados Unidos sa pamamagitan ng COVAX facility ang ating natanggap noong linggo, January 9, 2022. Habang nung Biyernes, January 7, dumating ang 150,540 doses ng Moderna vaccine. Ito ang unang 2 vaccine deliveries para sa taong 2022. Suma total ay meron na tayong 213,487,520 total vaccines delivered simula February of 2021. Samantala, naglabas ng isang joint memorandum ang Department of Health at ang Department of Trade and Industry na naglalagay ng purchase limit or cap sa paracetamol, carbocysteine at iba pang naka-flash sa inyong screen. Halimbawa, makikita nyo sa infographics na ang 500 mg na tableta ng paracetamol nasa 20 tabletas lamang ang maaaring bilhin ng isang consumer habang nasa 60 naman per household. Nakasaad din sa joint memorandum na ito na pinagbabawal ang online selling ng mga nasabing gamot unless otherwise permitted by the FDA. Pumunta naman po tayo sa COVID-19 update. Ayon sa January 10, 2022 COVID-19 case bulletin ng Department of Health, nasa 33,169 ang bagong kaso ng COVID sa bansa. Sa bilang na ito, 97.1% ang mild at asymptomatic. Napanood ninyo kagabi sa Talk to the People, ang severe at critical cases ay comparatively lower than that observed during our September peak. Yan po ang kailangan natin i-emphasize. May mga nagsasabi na bakit pa kailangan magpapakuna o magpa-booster kung mahahawa ka rin sa COVID. Please allow us to reiterate that the protection provided by vaccines comes not just in the form of reducing the likelihood of infection. It also comes in the form of reducing the risk of developing severe COVID symptoms. Pag bakunado po kayo, malaki po ang chance na kung mahawa man kayo ng COVID, magiging mild lang po ang symptoms ninyo. Isang bagay ang hindi maitatanggi. Gumagana ang lahat ng bakuna. Anuman ang brand ng mga ito. Vaccines work regardless of brand. Let me repeat our figures. 97.1% of our 33,169 new COVID cases exhibit mild symptoms or are asymptomatic. Kaya kahit mas marami tayong kaso ngayon kaysa noong Setyembre, mas mababa ang bilang ng kaso ng severe at critical cases dahil ito sa malawakang pagbabakuna. Sa iba pang datos, nasa 46% ang ating positivity rate, habang nasa 93% naman ang porsyento ng gumaling at nasa mahigit 2.78 million ang nakarecover. Malungkot naman naming binabalita sa inyo na kahapon ay mayroong 145 ang naitagdag sa bilang ng mga pumanaw dahil sa coronavirus. Nasa 1.74% ang ating fatality rate at ito ay nananatiling mas mababa sa 2% global average. Samantala, patuloy ang pagtaas ng ating hospital care utilization rate. Nasa 52% ang utilized ICU beds sa Metro Manila, habang nasa 30% naman sa buong bansa. 54% ang utilized isolation beds sa Metro Manila, habang nasa 41% sa buong bansa. 67% ang utilized ward beds sa Metro Manila, habang 41% naman sa buong bansa. 25% ang utilized ventilators sa Metro Manila at 17% sa buong bansa. Kaugnay nito, ito po ang mensahe namin. Tumulong tayong protektahan ang ating healthcare system. Sa mga walang sintomas o may mild or moderate na symptoms, pwedeng mag-isolate sa bahay. This will help us prioritize healthcare facilities for those with severe and moderate cases of COVID or high-risk COVID cases with comorbidities. Paalala lamang po, ang home isolation ay papayagan kung una, hiwalay ang inyong kwarto sa ibang mga miyembro ng pamilya. Pangalawa, kapag may sariling banyo ang kwarto. At pangatlo, kapag walang kasamang matanda, bata, or may comorbidities. So let's do our part to prevent the spread of COVID. If you suspect that you have COVID, stay home, isolate, at makipag-ugnayan sa inyong LGU o sa doktor tungkol sa telemedicine. Makikita po sa inyong screen ang ating telemedicine partners. Bago po tayo magtapos, some updates lang po regarding Typhoon Odette relief operations. Iniulat po ng Office of Civil Defense na nasa mahigit 122 million pesos na ang kanilang naibigay na assistance, habang merong 487.5 million peso fund for shelter assistance ang inilaan ng Department of Human Settlements and Urban Development at ng National Housing Authority. Sa bagyong Odette pa rin, nagpahayag ng pagsang-ayon ang Pangulo sa suhestyon na magtayo ng mini sawmills o tistisan ng kahoy sa mga lugar na sinalanta ng bagyong Odette. On other issues, the Bangko Sentral ng Pilipinas reported that foreign direct investments or FDI net inflows rose for the 5th straight month in October 2021. registering a 98.9% growth from $430 million in October of 2020 to $855 million in October of 2021. Dito po nagtatapos ang ating opening statement. Guest po natin ngayon si Department of Health Undersecretary Leopoldo Bong Vega. Yusek Vega, ano po ba itong Bexovid at paano po ito makakatulong sa mga pasyenteng may COVID-19 at paano po ma-access ang gamot na ito? The floor is yours, Yusek Bong Vega.
Magandang hapon ho sa lahat, Sir Karlo, sa lahat nakikinig ngayon at sa aking mga kasama ho sa Department of Health at sa ibang ahensya ng gobyerno. Maraming media partners po natin. Magandang tanghali po sa inyong lahat. Unang-una, Sir Karlo, at least ngayon nailagay tayo sa isang situation na meron tayong pag-asa or hope compared nung 2021 at 2020 kasi meron na tayong mga bagong gamot na pwede nating makuha sa 2022. Ito, ang una nito, itong antiviral drug, no? Na nagawa po ng Pfizer at ang ano nito, ang generic name nito is Nirmatrelvir, Trelvir, at ito ay unang nakita po at na-examine at na-research doon sa Pfizer sa USA at nakita nila sa data ho nila sa lahat ng mga pasyenteng nabigyan po nito, nag-reduce ang kanilang hospitalization and death to about 90%. Ang unang antiviral kasi na lumabas sa market, sa merkado, ay yung Molnupiravir. Isa din yung antiviral drug na ginawa ng Merck. Pero ngayon, sa kakalabas ngayon ng mga resulta, mga 30 to 40% ang kanyang reduction in hospitalization and death. So itong Bexcovid ngayon, ito yung trade name ng Nirmatrelvir. O sa US, ito yung Paxlovid. Itong antiviral na po ito yung may bigay sa mga pasyenteng with mild and moderate, lalong-lalo na sa mga high risk, no? Kasi talagang bababa ang kanyang hospitalization and even death. Ngayon, itong Paxlovid to be given in 5 days at nasa isang package nga yan sa itong Bexclovid or Paxlovid for the next 5 days. Ito ay talagang makakabigay ng medyo pag-asa sa ating 2022, lalong-lalo na itong pag-harap natin sa COVID-19. At least meron na tayong mga gamot aside from the vaccination that we are pursuing. So yun, Yusek Karlo.
Maraming salamat, Yusek Bong Vega. Please stay on board for questions from the media. And we'll now go to Yusek Rocky for those questions.
Yes, good afternoon, Sec Karlo and kay Yusek Vega. Magandang hapon din po sa ating mga kasama sa MPC. Una pong tanong mula kay MJ Blanca Flor ng Daily Tribune. May we request for policy reaction daw po. Vice President Robredo says the national government should use incentives to encourage the unvaccinated to get COVID-19 jobs instead of threatening to arrest them.
Opo, meron naman po tayong mga incentives na binibigay. Kung naalala po ninyo, at the start, nung umpisa pa lamang nitong dumating sa ating bansa yung mga vaccines, no? Nagkaroon ng mga incentives ang iba't ibang ahensya ng gobyerno, katulad ng Department of Transportation, nagbigay sila ng libreng sakay, no, sa kanilang MRT, LRT, and PNR lines during the first phase, no. Ang Department of Tourism was also nagbibigay din po sila ng incentives during that time sa mga free access sa ating mga tourism establishments, tourist spots, no. So hindi ako nagkakamali, libre sa makapasok sa Fort Santiago noon. And then dun sa private sector din, nagbibigay din po sila ng mga insentibo noon. Tulad ng mga restaurant, no, nagbibigay sila ng mga diskwento. But right now, kung titingnan natin, nag-shift na tayo sa alert level systems, ano, sa alert level systems po natin, meron din po tayong binibigay na incentives based on our alert level system. Kung matatanda ninyo, sa alert level 2, sa alert level 3, at maging sa alert level 4, ang incentive po for fully vaccinated ay makakapasok po sila sa mga indoor establishments that we have defined sa alert level systems natin. Katulad na lamang sa alert level 2 at alert level 3, yung pinapayagan natin, yung indoor capacities, halimbawa ng dine-in establishments, mga restaurant, pwedeng pumasok doon ang mga fully vaccinated lamang. Doon sa MICE events, sa tourist attractions, sa cinemas, movie houses, even religious gatherings, personal care establishments, gyms, fitness studios, even film production, ang pinapayagan natin sa indoor are only fully vaccinated. So ito po yung incentives for fully vaccinated, makaka-access po sila sa mga indoor establishments that are well-defined under our alert level systems.
Opo. Second question po niya, some groups daw po are opposing the IATF guidelines on shortened quarantine isolation period for fully vaccinated health workers who got exposed to COVID-19 or acquired COVID-19. They say that it will further accelerate the spread of infection and may also endanger the patients, and that it shows that medical frontliners are treated as modern-day slaves. How will the palace address these concerns?
Hindi naman po. Actually, kung babasahin niyo yung resolution, yung latest resolution ng IATF, nakalagay po doon na, for instance, no, for those who are isolated dahil nga meron silang mild or asymptomatic na COVID. So meron tayong rules on number of days for isolation, no? Shinorten lang natin under extreme circumstances, but always po, if it is recommended and with clearance from the hospital. Kasi yung mga hospitals, meron po silang tinatawag na Hospital Infection Prevention and Control Committees. So it is these committees ng hospitals that will determine kung pwede bang ma-shorten. For instance, yung naka-quarantine dahil na-expose. So it is the hospitals, the health experts in those hospitals, those committees na mag-assess dun sa mga na-exposed na healthcare workers kung fit na ba sila to be brought back in circulation, no? So yun po, under our resolution is very clear that it has to pass through those committees, and again, it is only done in extreme circumstances pag kailangan. Dahil nga po need na po nung hospitals na yon, no? And para hindi mag-suffer ang health services of those hospitals. Maybe we can ask Yusek Bong Vega to add and chime into that.
Thank you, Sir Carlo. Unang-una, itong IATF resolution ay nakabase naman sa certain basis, no? And these are peer-reviewed data coming from the US at saka sa Europe. Alam natin na itong Omicron, even with the spike in cases, are mild. And they found out that because of this high transmissibility, ang incubation period niya is about 2 to 3 days lang. Compared yun sa original kasi original Wuhan virus, COVID-19, yun ang mas mahaba yung incubation period, 5 to 7 days. Kaya matagal mong kailangan ma-isolated, ma-quarantine. Now, itong pag natin sa healthcare workers, alam natin kasi 93% na kasi bakunado. And they are protected in a way against the virus, especially this Omicron for hospitalization and even death. And ang reason naman na naging 5 days yan for the, especially for the asymptomatics, is because we believe that on the 5th day, if you're vaccinated, the viral load is very low, and you are no longer, you can no longer transmit the virus to, or you are not contagious. So ito yung talagang dahilan kung bakit inuna natin ang healthcare workers, kasi madali sila ma-monitor ng kanilang infection and control committee dyan sa hospital. So they're being monitored, and besides, they are also fully vaccinated, not 93% even with booster. Now, ang gagawin po namin, nag-propose na rin ng DOH na i-streamline natin to sa general public, because para to harmonize the isolation and quarantine protocols, we would like it's proposed by the Department of Health, and of course this proposal will be sent to the IATF for consideration and approval na mag-isolate na ho tayo once kasi 60% naman natin ngayon dito sa bansa Omicron, and basically we can actually isolate the asymptomatic cases for especially if you're vaccinated for 5 days, similar to the healthcare workers. Over to you, Mr. Karlo.
Thank you, Yusek Rocky.
Opo. Susunod pong tanong mula kay Laila Salaveria ng Inquirer. Secretary Galvez daw po said the increasing number of cases is hampering the vaccination drive because healthcare workers and LGUs are focused on caring for those in the hospitals, and because the healthcare workers are getting infected or exposed. How will the government address this? How does it plan to ensure there will be enough personnel to conduct the vaccination, especially since the President has ordered the NVOC to increase the vaccination rates outside the National Capital Region?
Yes, according to Secretary Charlie Galvez, doon sa Talk to the People kagabi, they in the NVOC and Secretary Galvez will be looking into augmenting, So magkakaroon na proposal for manpower augmentation to make sure na mas marami pong manpower, yung mga manpower requirements natin to increase our vaccination on the ground, especially sa mga regions, especially sa mga provinces. Gagawin po ng NVOC and through Secretary Charlie Galvez with the full support of the President.
Opo. Sec Karlo, susunod na magtatanong via Zoom si Melales Moras ng PTV.
Hi, good afternoon, Secretary Nograles at kay Yusek Vega at kay Yusek Rocky. Secretary Nograles, unahin ko lang po yung sitwasyon nga sa NCR dito sa pagtaas ng COVID-19 cases. Sabi rin kasi ng Octa research, nasa severe outbreak na ang NCR, and even the DOH reported last night na patuloy nga rin yung pagtaas ng cases dito sa NCR na nangunguna rin nga sa may pinakamaraming kaso ng COVID-19. My question is the government po still on top of the situation at magko-qualify na ba yung sitwasyon ngayon para sa higher alert level sa NCR?
Yes, actually kung titingnan mo, to be very transparent about it, meron kasi kaming decision matrix, and this can be found in IATF resolution number 152. So dito makikita po natin, lagi kong sinasabi, tatlo yung tinitingnan namin dito, yung 2-week growth rate at yung average daily attack rate. So kung titingnan natin, halimbawa sa Metro Manila, nasa high na po tayo sa 2-week growth rate at nasa high din po tayo sa average daily attack rate. Kaya nga po, ang risk classification po natin is critical. So yun yung nasa top right most naka-color gray dyan sa ating graphic. And because of that, nasa critical high risk na po tayo, titingnan naman natin yung total beds utilization dito sa left-hand side of this chart. So sa left-hand side of this chart, makikita natin yung total bed utilization. And kahit bagamat nasa critical na po tayo, ang total bed utilization natin ay hindi pa po pumapalo sa 71% and up. And that is the reason why we are in alert level 3. So makikita nyo, nasa between 50 to 70% po ang ating total bed utilization. At using this chart, you go to the rightmost hand side, you will see na even under critical, nasa alert level 3 pa rin po ang category natin. So ito yung binabantayan natin, yung total bed utilization. Pag pumalo po ito ng 71% and higher, or 71% to 84%, dito po natin masasabi na dapat i-alert level 4 na po ang Metro Manila. As of the moment, hindi pa po tayo nagbi-breach ng threshold na yan. And that is why Metro Manila still remains under alert level 3.
Opo. Thank you so much for this chart, Secretary Nograles. And speaking of alert level system nga po, kailan po ba magpupulong ang IATF members para naman isapinal yung magiging bagong alert level system sa Pilipinas at sa NCR? At ano-ano po yung mga inaasahang magiging bago pang pagdedesisyonan ng IATF para nga mas matugunan pa yung pagtaas ng COVID-19 cases sa bansa?
Sa Thursday, ang next IATF meeting natin. And the reason why we are pushing it on Thursday, which is January 13, is pagdedesisyonan din po namin yung magiging classification ng iba't ibang bansa. Kung siya pa ay green, yellow, or red, no? Red list. No? So we have to get the data as close as possible to January 16. No? Paano yung kasi January 16 na po mag-uumpisa yung new classification of countries, especially yung red list. So as close to January 16 as we can. Kaya January 13 po ang aming IATF meeting para pag-usapan una yung alert level system classification ng buong bansa. Then secondly, and that is for January 16 to January 31. At ganoon din po sa pagre-red list, yellow list at green list natin ng countries from January 16 up to January 31.
Opo. At panghuli na lamang, Secretary Nograles, kung mapapansin po kasi natin talaga, marami na rin tinatamaang muli ng COVID-19 sa mga government officials and workers at marami na rin apektadong ahensya. Paano po ito nakakaapekto sa government services? Ano po yung mensahe niyo sa publiko sa gitna ng sitwasyon?
Kaya nga po, sa Talk the People kagabi, si Pangulo na mismo ang nagsalita. No? At ang sinabi nga po niya that government services must not be unhampered, must not suffer, must continue in light of and especially because of the rising cases ng COVID-19. So, meron po tayong mga sinusunod na mga protocols, meron po tayong sinusunod na mga memo circulars halimbawa na pinapalabas din po ng Office of the President na bagamat kailangan natin mag-reduce ng workforce. Ang head of agency, the head of agency and the head of department must make sure na even with the reduction of workforce, dahil nga po may mga tinatamaan na ng COVID sa ating mga kasamahan sa gobyerno, ay dapat hindi pa rin po magsasuffer ang public services.
Okay. Maraming salamat po, Secretary Nograles, kay Yusek Vega at Yusek Rocky.
Thank you, Mela. Sir Karlo, susunod pong magtatanong ay si Laila Salaveria na Inquirer. Ito po yung tanong niya, how will the government ensure that the forthcoming elections will not distract from the vaccination drive, which is another concern that Secretary Galvez had raised?
Yes. Of course, what we in the national government will do is make sure na hindi ma-hamper ang aming trabaho. We will continue to focus on that. On the deliverables na binanggit nga ni Secretary Charlie, may mga targets po tayo. Nakaset po yung targets na yan. And we will continue to deliver sa national government. But the reality, syempre, is that we have to coordinate with the local government units, no? And ang reality din po, pagdating naman sa local government units, many of them are elected, no? Public officials. Of course, may mga appointed public officials sa LGUs, but syempre yung local chief executives are elected, no? At may election nga na forthcoming. So we will have the DILG to ensure that the local government units deliver as far as vaccination efforts are concerned, and even as far as response to COVID-19 is concerned. We will make sure that the vaccination and our COVID response is not politicized, and that everybody stays and remains neutral, especially sa pamamahagi natin ng vaccines. Dapat walang pinipili yan. And we will make sure that the targets are met.
Susunod pong tanong mula kay Jopel Peleño ng DWIC. Ayon sa Okta Research, by next siguro to, next week po to, there's a possibility that the healthcare utilization rate in Metro Manila would increase to more than 70%. At sapat na daw to para itaas sa alert level 4 ang NCR. But despite of this, sinabi ni MMDA Chairperson Benhar Abalos that there's no need nailagay sa alert level 4 Metro Manila. Any reaction regarding this?
Opo. So based on the chart that we showed you, based sa IATF resolution number 152, tama po yan, hindi pa po tayo nagbe-breach yung threshold for alert level 4. No? So hanggat tumama yan sa 71% to 84%, that's the only time na mag alert level 4 tayo. Unless tumama po diyan, we will continue to be on alert level 3. That being said, we have to manage our hospital beds to make sure na ang priority para sa hospital beds should be severe, critical, the elderly, yung may comorbidities, and yung vulnerable. Yung mga mild and asymptomatic ay kailangan i-step down natin sila to TTMFs natin or yung ating isolation facilities, at kung pwede mag-home isolation at mag-telemedicine, telehealth care, ay doon natin sila dadalhin, no? Kung angkop naman at suitable for home quarantine or home isolation, no? Para ma-reserve po natin ang ating beds for those who need it. Severe, critical, vulnerable, elderly, and those with comorbidities. Perhaps we can ask Yusek Bong Vega as well to talk about yung pagpa-prioritize natin ang beds for those who need it most. Yusek Bong?
Yes, thank you, Sec Karlo. I think we all understand that the metrics that we're using for high classification is the 2-week growth rate. Yun yung measure ng growth ng epidemic. At saka yung ADAR, which is the average daily attack rate, which is a measure of the risk of infection. Lahat yan mataas. In fact, yung 2-week growth rate natin more than 200% and the ating ADAR is more than 7. So classified talaga ang Pilipinas because of the high new cases that we have, the active cases, as high-risk classification, including the NCR. Pero nakakaiba talaga to sa ating nakikita, no? Compared of last year, when we were high-risk, on a high-risk classification with the two metrics, yung HCUR natin, mataas din. In other words, it correspondingly, directly also increased with the increase in the number of new cases. Pero ito ngayon, tumataas yung ating dalawang metrics, pero yung HCUR natin, hindi sumasabay gaano, no? It parang nag-decouple siya from the rise in new cases and the rise of hospitalization. So ito yung dapat titingnan natin. We should not focus on the number of cases kasi alam natin exponential talaga itong Omicron, highly transmissible, and only it can produce mild diseases. Pero what is very important to note is ilan ba yung na HCUR natin in terms of ICU, ilan ba napasok sa ICU, ilan ba nagagamit natin gumagamit ng ventilators at saka oxygen. Kasi ito yung mas itong parameter talaga to, or metric na to, ito yung makikita natin kung gaano ka serious talaga itong Omicron. So for the latest, with a very high risk tayo sa two metrics, ang ating HCUR ngayon is 57% with 52% na sa ICU. So alam natin na tataas talaga ito if we are not able to bring it down. And the sheer volume of the rise can also have an increase in the HCUR. So I think the government is ready, the Department of Health is ready in terms of the isolation and the intensive care units that should be available. Because for the last 2 years, this is what we have been doing, trying to expand and increase the hospital capacity.
Thank you, Yusek Vega. Sec Karlo, tanong mula kay Chris Hussein ng Remate Online. Reaction daw po sa sinabi ni Vice President candidate at Mayor Sara Duterte na hindi raw dapat maharap sa diskriminasyon ang mga unvaxxed residents matapos magpatupad ng mas mahigpit na restriction ng gobyerno laban sa mga ito. Malinaw naman daw na hindi mandatory sa lahat ang magpabakuna laban sa COVID-19. May choice din daw ang mga unvaxxed residents na hindi magpabakuna. Hindi rin sang-ayon si Mayor Sara sa exclusion or restriction sa mga unvaccinated.
Yes, of course, we respect the opinion of Mayor Inday Sara Duterte. On the other hand, the President is only trying to protect the unvaccinated from harm. Nakikita naman po natin sa datos na yung kapag unvaccinated, mas mataas po ang chances na magiging severe or critical COVID yung mga unvaccinated. So as father of the nation, the President is only trying to protect the unvaccinated, and this is for the common good.
Thank you, Sir Carlo. Susunod pong magtatanong ay si Tricia Terada ng CNN via Zoom.
Good afternoon, Secretary Nograles, and to Yusek Veg and to Yusek Rafi. Sir, dun lang po sa protocol for isolation, meron po ba tayo, sir, incentive or paano natin i-convince yung publiko na nakakaranas ng sintomas to stay at home? Kasi, sir, di ba marami naman po hindi walang privilege of earning while staying at home. Marami yung no work, no pay. So, paano natin sila, sir, encourage? Kasi di ba yung mindset is, kung inisip na lang na it's just a common cold or flu, bakit mag-isolate? Baka mawalan sila ng means of earning for that day. Anong plano ng government for these people experiencing symptoms who are living on a day-to-day basis lang po talaga?
Well, during the meeting sa IATF, sa gaganapin na meeting ngayong Thursday, isa yan sa mga pag-uusapan natin. No? First of all, yung package, health package na pwede natin ma-offer for those who undergo home isolation. At dapat maging kabahagi natin dito, kasama natin dito, yung PhilHealth and of course the healthcare provider. That's accredited by PhilHealth. Para sa mga nag-home isolate. That's number one. So in terms of the health aspect, pag-usapan namin yan sa IATF. Pangalawa naman po, for those who are employed, then obviously, pag nagkasakit, then it has to be clarified by the Department of Labor and Employment. Ano yung pwedeng ng employer, ano yung regulations natin for employees who call in sick, that we have to isolate, syempre, and it's for the good of that person as well as the company and the employer and all of the employees, that person remains isolated at home. And ano yung very clear din for the Department of Labor and Employment, very clear for the employee and for the employer kung ano yung magiging roles nila. Then of course dapat pag-usapan din po natin kung paano yung self-employed or those who are not employed. Ano ba yung pwede rin po nating ibigay na incentive sa kanila. So this is something that pag-usapan namin sa IATF.
Mm-hmm. Sir, do we still have funds ever ma-iron out po itong mga healthcare packages or incentives?
Well, we're working on a new budget right now. It's 2022. So it's a fresh budget. Then of course the challenge would be to look in the budget, in the General Appropriations Law, ano yung pwede ma-charge yan if ever we come up with a decision in terms of this court.
Mm-hmm. Sir, I understand hindi pa na natin na-reach yung threshold for alert level 4. But in any case, sir, if the situation worsens, can we afford an alert level 4 scenario?
Yes. As mentioned by Yusek Bong Vega, and I'll pass it off to him, that we have been preparing naman our hospitals, and which is why there's a call to increase the bed capacities. Diba? There's a call to increase the capacities of our TTMFs or our isolation facilities. And then of course, we are doing real-time updating on our healthcare workers din. Then yung augmentation ng healthcare workers. So all of these we're doing in preparation for that eventuality. Of course, we'll try to manage it in a way na hindi tayo darating sa alert level 4 by again stepping down or magsa-step down tayo. Kung mild naman at symptomatic, we'll have to step them down to the isolation facility or kung pwede mag-home quarantine so that we have more beds reserved for those who need it most. But if it reaches to the threshold, then we should be prepared. So, Yusek Bong, Vega.
Yes, thank you, Sir Carlo. Alert levels are totally different from what we had before. Ito yung mga lockdowns, ECQ, and wala talaga, mahirap talaga yon kasi kailangan talaga ng support coming from government, and there was no balance between the economy and health. So ito ngayong alert level 4 or alert levels, ito yung nag-emphasize na we are not here for a general lockdown, but rather on granular lockdowns, kung identify yung street or houses ng local government unit so that mabuhay naman yung kabuhayan ng mga ating mga kasamahan. So in other words, trying to balance things off. So I guess with itong alert level 4 natin, kung dadating man talaga to, ang Department of Health naman, we have been expanding our infrastructure. In fact, the other day, inaugurate natin yung 130 bed na for moderate and severe cases. It's a modular hospital. It's a big one, and together with housing about 90 healthcare workers in a dorm facility for them to be there during the time that they are on duty. So we've been trying to expand this. In fact, in terms of expansion of these modular hospitals, we have one right now which we have inaugurated yesterday. Previously we have one at Lung Center and in the QI managed by Jose Reyes, and in Batangas, but also in soon to be opened up would be the one in Zamboanga, the one in Iloilo, and the Davao Modular Hospital has already been functional since 4 months ago. So I guess we tried to really improve the setup of the hospital, the capacity internally by providing more beds allocated for the intensive care units. And of course, we supported the augmentation of the healthcare workers plus the medicines and the other needs of the intensive care units.
Thank you, sir. So with 33,000 cases, are we doing enough lockdowns? Because I understand meron pong 63 barangay lockdowns, I think over 100 households. Would that be enough, sir, to contain or at least to solve this rising number of cases?
Sorry, Sir Carlo. I just wanted to say that, itong mga infections nito, they occur in clusters. They occur in clusters, and easy for the LGU to actually contain them. Once they are contained, para yung transmission naman nila hindi kakalat sa ibang barangay. So, ma-identify ka agad dyan because they do occur in clusters.
Thank you very much, Dr. Vega, and to Secretary Karlo.
Thank you, Tricia. Yusek, Rocky.
Yes, Sir Carlo, ang tanong, susunod na tanong mula kay Bernadette Reyes ng GMA News. Bakit po pinapayagan ng shorter quarantine for flight crew kahit na may mga flights na na-cancel dahil sa mga nagkakasakit sa mga flight crew?
Ang pinayagan lang po ng IATF based on our resolution are for healthcare workers, and I think my team has a slide to show. This is coming from DOH. So for the general public, the general population, hindi healthcare workers working in hospitals. Kasi at least yung healthcare workers working in hospitals, meron silang Hospital Infection Prevention and Control Committee na napag-usapan natin kanina na sila yung magde-determine if pwede mag-shorten ang quarantine or ang isolation ng healthcare worker. But for non-healthcare workers, these are the rules that should be followed, no, based ng DOH, no. So makikita ninyo yung dito sa top part, this is isolation, number of days of isolation for COVID-19 cases, meaning to say positive sa COVID-19. And for fully vaccinated or unvaccinated even, pag positive case pero asymptomatic, mild or moderate, at the advice of your doctor, for 10 days ang isolation. Pag severe and critical naman, again, at the advice of your doctor, or 21 days. Dito sa baba, ito naman po yung quarantine for close contacts. Ibig sabihin, hindi ka positive, pero meron kang na-close contact, na positive sa COVID, no? At dapat kailangan mo mag-quarantine how many days? For fully vaccinated, it's 7 days, or at the advice of your doctor. Pag unvaccinated or incomplete ang vaccination, it's 14 days, or at the advice of your doctor. So this is for the general population, meaning to say, ang binigyan lang ng pahintulot ng IATF na shorter quarantine and short isolation are healthcare workers working in hospitals, and it is the Hospital Infection Prevention and Control Committee ang authorized lang po na mag-shorten. Anybody else, including flight crew, must follow these protocols for the general population.
Opo. Susunod pong tanong niya, bakit, although yung second question po niya, yan na nga po, Sir Karlo, na-discuss nyo na yung about quarantine protocols. Yung sunod po niyang tanong, bakit daw po iba ang standard sa flight crews? Is it because of the need to fly more flights? Ano ma-assure yung safety ng passengers na hindi daw po sila mahawa?
Again, wala pong ina-approve ang IATF na ibang standard for flight crews. Flight crews belong to the general population, so they have to follow the same standards as we flashed in the screen a while ago. Okay. Only healthcare workers working in hospitals that has its own Hospital Infection Prevention and Control Committee are allowed by our IATF to have shorter quarantines, again, in extreme circumstances lang po.
Opo. From Jason Rubrico ng SMNI News, para po kay Yusek, sa halos isang linggong pagpapatupad ng Alert Level 3, ano po ang assessment ninyo sa behavior at mobility ng mga Pilipino dito sa National Capital Region? Mas nag-iingat ba ang mga Pilipino ngayon sa gitna ng pagkatala ng all-time record high ng COVID-19 cases?
Pansinin nyo, Sir Karlo, can I answer?
Go ahead, Yusek po.
Yes, unang-una kung pansinin nyo ngayon, talagang natatakot na yung mga tao lumabas ngayon because of the high transmissibility ng Omicron. So, kaya kung papasok ka sa mall, papasok ka ngayon sa mga establishments, talagang kumukonte. At saka sa workplace nga, kumukonte na rin. In fact, dito nga sa DOH, marami na yung buildings na nag-close because naging positive. So, itong Alert Level 3, nakadulot din ng pagtakot sa iba nating mga kababayan na lumabas because of this high transmissibility of the Omicron virus.
Opo. Sir Carlo, sunod na tanong mula kay Creseline Catarong ng SMNI News. Ano po ang masasabi ninyo sa itinutulak na Chacha at term extension para sa Presidente, House of Representative at iba pang posisyon sa local level?
May paparating na eleksyon sa May 2022. At sa palagay ko, wala nang oras ang Kongreso sa panukalang ito. At isa pa, meron tayong mas mabigat na laban. At ito po yung laban against COVID-19.
Opo. Sunod pong tanong mula kay Margot Gonzales ng SMN9 News. Yung ano daw po ang komento ng Malacanang hinggil sa hacking incident na napaulat sa mga server ng COMELEC, pangamba ng mga political aspirants, baka laki ang magiging epekto nito sa voting system o kakalabasan ng mga datos sa May elections. Sabi naman po ng COMELEC, bine-verify pa nila ang report.
We will await any update to be pronounced by COMELEC regarding this. No? Siyempre, nababahala rin kami. Obviously, we're also worried, no, about this, kung totoo man ito. So, tabayanan na lang natin, hintayin natin na magpalabas ng official statement ang COMELEC tungkol sa report na ito.
Opo. Sir Karlo, mula po kay Red Mendoza ng Manila Times, binabaliktad daw po ng ilang kritiko yung sinabi ninyo sa isang interview yesterday tungkol sa capability ng government to push mass testing, with people saying na, I quote, kung may gusto, may paraan, may kakayahan ba ang government na gawin ang mass testing na ginugusto ng mga di umano ay kritiko ng gobyerno kahit sobrang limited ang resources natin?
Responsible testing po yung ginagawa natin, no? Responsible testing kasi we have to be mindful na hindi unlimited po ang resources ng pamahalaan at ng Pilipinas. And we have to be smart in where we will put our resources, no? Kaya natin bumili ng bakuna, no? At napakita naman po natin that mas cost-effective po yung bakuna. Mas maraming mababakunahan natin, mas marami pa po tayong maiiwasan na maging severe at critical na cases ng COVID. No? Kailangan din po natin bumili ng mga antiviral drugs tulad ng na-report na po ng FDA, tulad ng nasabi ni Yusek Bong Vega. Kailangan din po natin mag-augment ng mga manpower natin for healthcare workers. And of course, it comes with increasing our functional bed capacities, ang ICUs natin, the infrastructure that we need to increase the bed capacities ng ating mga hospitals. Marami pong aspeto ang laban nito against COVID. And we have to be very smart kung saan natin ilalagay ang pera ng taong bayan, ng sambayan ng Pilipino. Kailangan matalino tayo sa pagpili saan natin ilalagay. Nandiyan naman yung testing, nandiyan naman po ang PhilHealth na nagpo-cover ng mga testing ng mga symptomatic at mga positive na COVID cases. So this is what I call na smart testing, no? Responsible testing. Hindi tayo pwede na itetest na lang lahat na napakarami. We have to be able to smartly, wisely determine ano po yung testing na gagawin natin na i-cover po ng pera ng taong bayan sa pamamagitan ng PhilHealth. At yan lang po yung dapat natin i-focus yung resources natin. Testing is part of the PhilHealth package. And then we are also putting PhilHealth again, as I said earlier, na kahit sa home isolation ay kasama dapat sa PhilHealth coverage po yung test ng naman nag-home isolate, no? And we have to find and identify na credit provider will provide that. Dahil yung pagbayad po ng PhilHealth dun sa libreng testing ay hindi naman mapupunta dun sa pasyente, dapat mapupunta yan sa provider. So ito rin yung isa sa pag-uusapan namin sa IATF, no? Yung provider na magpo-provide ng testing na dapat covered ng PhilHealth para dun sa mga nag-home isolate na positive sa COVID cases, no? So Yusek Bong Vega would again like to add to this issue about mass testing versus responsible testing. Naka-mute po kayo, Yusek Bong.
Thank you, Sir Karlo. Sir Karlo, the policy naman sa Department of Health and sa RIT itong testing is targeted testing naman talaga or responsible testing. Kasi kung magma-mass testing tayo, ang daming mga negatives niyan. Sayang naman ang resources nga natin. Kung wala naman kayong exposure at saka walang symptoms, siguradong negative yan. So really, it's targeted testing. Pati na sa antigen test natin na pinapayagan ng Department of Health, kailangan symptomatic kayo para mas accurate yung result mo. Kung positive ka niyan, positive ka talaga, at saka mataas ang specificity. So at saka sa yung pag-close contacts ka rin. So in testing, parating targeted talaga to a certain population.
Tanong pa rin po mula kay Red Mendoza ng Manila Times para po kay Yusek Bong Vega. Ang grupo po ng mga healthcare worker ay nagrereklamo na hindi raw sila kinonsulta sa bagong directive ng DOH sa isolation and quarantine protocol sa mga healthcare workers. Dagdag nila na parang insulto raw itong department order na itong guidelines na ito. Ano ang masasabi niyo dito?
Hindi naman ano yun, hindi naman insulto kasi unang-una dadaan yan sa hospital administration nila at saka sa Hospital Infection and Control Committee who will discuss it with them. Kasi ang proposal na naman yan na ibigay ng aprubahan ng IATF is through the discretion of the Hospital Infection and Control Committee. Kung pagtingin nila hindi pa kailangan na siguro mag-report back ang isang tao dahil may symptoms ba, then they can do so. So ito yung sinasabi natin na talagang binibigyan natin ng paunang limited ang isolation ng mga asymptomatics na healthcare workers kasi alam natin na fully vaccinated sila and they have a certain protection.
Opo. Yusek Vega, sunod pong tanong niya, may mga nagsasabi na hindi raw nakokontrol ng gobyerno ang pandemic sa sobrang taas ng COVID-19 lalo na't marami ng healthcare workers ang nakakasakit. Plano rin ba daw po ng DOH na mag-mass hiring at gawing permanent ang mga health worker tulad ng pinupush ng ilang grupo?
Yes, Rocky, unang-una, no government can control the COVID storm. Medyo yan talaga mahirap and very unpredictable on how to go about it. Pero ito yung sinasabi natin na ang ating hiring naman kung pangangailangan ng mga healthcare workers sa different regions ginagawa natin yan po. In fact, since last year nagde-deploy kami ng mga augmentation sa mga regions na nangangailangan. Before noon sa Cebu, dito sa Metro Manila, Northern Mindanao and Southern Mindanao. So yun ang ano natin talaga, augment tayo ng healthcare workers. In fact, sa itong bagong GAA natin, meron pa rin tayong funds for the augmentation of the healthcare workers. Dalawa, nakipag-usap na rin kami sa uniform personnel through Sec Charlie Galvez na gagawing national policy na ang deployment especially in times of need ng different hospitals, treatment facilities or even testing sites na magpa-deploy ng mga uniform personnel coming from the BFD, AFP, and the other areas of the military. So ito yung ginagawa po natin, deployment talaga from other health sectors that are least affected to areas na talaga nangangailangan.
Opo. Susunod pong tanong, Sec Karlo, mula po kay Joyce Balancio ng ABS-CBN, may isa umanong courier company nagpapapasok sa mga empleyado nila kahit positive sa COVID-19 dahil kulang sila sa manpower. Yung mga empleyado nila may mga biyahe, so may nakakasalamuhang kliyente pa. No work, no pay din sila, kaya kahit may sakit, pinipilit na lang nila pasok. Kahit yung mga pwede namang mag-work from home, napipilitang pumasok sa office nila dahil may bawas sa sweldo kapag the work from home. Ano ang violation nito? Ano ang dapat gawin sa kumpanya? Ano ang paalala ng IATF sa ganitong mga kumpanya?
Palagay ko, una sa lahat, may mga violations yan sa labor code, no? So labor law violations, meron na yan. And as far as IATF is concerned, sa mga issuances ng IATF, at dahil sa paglabag, no, kung di umano, no, kung totoo itong nakuha nilang report, kung itong kumpanya na to, sinumang kumpanya ang lumalabag sa mga resolutions at kautusan ng IATF, ng Pangulo, paglabag po yan sa Notifiable Diseases Act. No, kasi positive, tapos pinapapasok, o di nagkakahawaan. So it's dapat, by the name itself, Notifiable Diseases Act, dapat may tungkulin po una sa lahat, ang korporasyon, ang kumpanya na sundin ang kautusan ng Pangulo, pati yung resolutions ng IATF. Pangalawa, kailangan nilang i-report. Ito, hindi na nga nagre-report, hindi na nire-report, tapos ang ginagawa, kabaliktaran, pinapa-report yung positive. So at the very least, meron din violation yung Notifiable Diseases Act. So may mga parusa po na nakalagay dito, at pag korporasyon po, siyempre yung Chief Executive Order, the President, General Manager, or such other officer in charge will be held liable, yung business permit at license to operate shall be cancelled. Plus, may mga labor laws violations din po yan and other similar laws. Bahala na po yung prosecutor sa kanila.
Opo. Susunod pong tanong mula kay Joseph Morong ng GMA News. Yung pong unang tanong niya, Yusek Vega, nasagot na ni Yusek Vega about dun sa hospital capacity at saka yung projection po ng Octa Research. Yung third question po niya, Yusek Vega, do you have reports of healthcare workers going back to work as early as 5 days after being diagnosed with COVID?
Thank you, Yusek Rocky, for the query coming from Joseph Morong. Unang-una, wala pa kaming report ng coming from the Infection and Control Committee na pinababalik yung healthcare worker to work after a few days, less than 5 days of isolation. Pero gusto ko i-report ngayon na dito ho sa Metro Manila, almost na-quarantine, na-isolate na healthcare workers, mga abot na ata ng 6,595 out of 91,838 healthcare workers. So mga 7.2% ito under quarantine. So ang ginagawa ngayon ng mga hospitals, lalong-lalo na sa mga bigger centers, nag-focus sila ng ibang services para ma-redeploy yung mga areas na kailangan for COVID ng kanilang mga personnel. So ang nakikita natin is nagpo-close yung mga some services like elective surgeries, OPD, and the rest, like diagnostics, para lang makakover ngayon sa mga healthcare workers na isolate o naka-quarantine.
Opo. Pahabol lang po ni Joseph Morong ulit. Yusek Vega, how would you describe daw po the level of manpower of healthcare workers vis-a-vis need for workforce because of the surge?
Alam natin ang unang challenge talaga natin ay unang tinamaan yung mga healthcare workers because they're more exposed. Saka yun nga, 7.2% sa kanila dito sa NCR ay naka-isolate and quarantine. Kaya ang ginagawa po natin ngayon sa Department of Health, pinatuloy namin yung mga augmentation ng mga healthcare workers mula noong 2021 at saka dito para sa 2022. So roughly naka-position na kami ng mga 7,000 plus of healthcare workers na augmentation for the different hospitals, isolation centers, and testing center.
Thank you, Yusek Vega. Thank you, Sir Karlo. Thank you, MPC.
Maraming salamat, Yusek Rocky, Yusek Bong Vega, at sa mga miyembro ng Malacanang Press Corps. Mga kababayan, 8 out of 10 Filipinos are hopeful that the worst of the COVID-19 is behind us, according to the latest Social Weather Station survey. While COVID cases continue to rise, we share this outlook given how the data shows us that our vaccination program has successfully protected our population from the worst effects of the virus. Tulad nga ng sinabi Pangulo kagabi, kaya natin ito. Magpabakuna lang po tayo. Malinaw po mga kababayan na nasa atin ang desisyon na may magagawa tayo laban sa COVID. Kahit matindi makahawa ang Omicron, hindi po tayo helpless. We can do something about it. Magpabakuna na po tayo. Anumang brand ito para maging ligtas, para sa karagdagang protection natin ng ating mga mahal sa buhay at ng ating komunidad. To quote Pope Francis in his recent State of the World address, healthcare is our moral obligation. Dagdag pa ng Santo Papa, and I quote, we have realized that in those places where an effective campaign has taken place, the risk of severe repercussions of the disease has decreased. It is therefore important to continue the effort to immunize the general population as much as possible. End of quote. Nasa Diyos po ang awa. Nasa tao po ang gawa. Patuloy po tayong manampalataya sa Diyos na lumikha. Ipagpatuloy din po natin ang ating pagbibigay malasakit sa isa't isa upang protektahan ang ating mga sarili, ang ating pamilya, ang ating komunidad, at ang ating bansa mula sa banta ito ng COVID-19. Maraming salamat po. Ingat po tayong lahat. And God bless us all.